So I'm Zach DuBois. I am a board-certified family medicine physician practicing at Beacon Medical Group Center for Family Practice in Goshen, Indiana. How should a guy bring up talking about testosterone replacement therapy with his doctor? I think start by just talking about some symptoms that you're having and kind of go from there. So typical symptoms of low testosterone include low libido or low sex drive, difficulty recovering from workouts, difficulty putting on muscle mass, and more non-specific things like fatigue, as well as issues with the quality of your erections. So testosterone replacement therapy, or TRT, is hormone replacement therapy for men who are experiencing symptoms related to low testosterone. And so for testosterone replacement therapy, we typically like to treat symptoms in addition to lab values. So we really want to make sure that you are having symptoms, and then we want to check those lab values. And things we're looking at are testosterone. We look at free and total testosterone. We also like to get different labs, including FSH, LH, sex hormone binding globulin, prolactin, and estradiol. And we like to make sure that we are dealing with primary hypogonadism versus a secondary cause. There's lots of benefits to testosterone replacement therapy. Heart health and cardiovascular health is very important as it relates to men and their testosterone levels. Also, prostate health is very much related to testosterone. Previously, we used to think that giving testosterone replacement therapy used to put you more at risk for having prostate cancer, issues with prostate. What we really found out with recent trials like the Traverse trial and different studies that have been done is that actually higher testosterone levels are linked to lower risk of prostate cancer. So there's really no issues with prostate cancer as it relates to giving testosterone replacement therapy. We can sometimes see elevations in the prostate gland itself, which is typically called BPH, which is a benign growth of your prostate. So we can see some of those symptoms, but typically it has a net benefit of impact on your prostate health. Also can improve your cardiovascular health and include your bone density as well. And it improves muscle health in general. So if you are having symptoms related to low testosterone and we do check your levels and you do have some evidence of having low testosterone, that's not necessarily a slam dunk that we need to initiate testosterone replacement therapy right then. Typically, I like to wait 1 month and repeat those levels to make sure that we are indeed dealing with sustained low testosterone levels before initiating therapy. There's lots of things that you can do to improve testosterone levels on your own as well. For men, when you're in your 20s or 30s, you're naturally going to start seeing lower levels of testosterone. That just starts to occur naturally. But things that you can do to improve your testosterone levels, I always like to talk to my patients about improving their fundamentals or foundations of their health. Eating, moving, sleeping, and stress management. So eating, your diet, really just want to be focusing on whole foods, meat, eggs, fruits, vegetables. You want to be making sure you're getting sufficient protein intake. For men and women. It's really typically 1.6 to 2.0 kilograms per or grams per kilogram of your body weight. So you want to make sure that you're eating appropriately, putting good things into your body. Exercise is very important. Resistance training and strength training is going to naturally increase your testosterone levels as well. So it's really important that you are optimizing your exercise regimen before initiating testosterone replacement therapy. And then you want to make sure that your sleep is dialed in as well. Sleep plays a huge role in your testosterone levels. And so for adults, you really want to be getting 7.5 to 9 hours of sleep. We want to make sure that you're not having any issues with sleep apnea, because if you're getting poor quality of sleep or if you have issues with sleep apnea, that can also lower your testosterone levels. So we want to make sure that we've optimized your diet, exercise, and sleep before initiating therapy. And additionally, you want to make sure that you're managing your stress as well, because stress and cortisol, high cortisol levels are going to decrease your testosterone levels as well. So before initiating therapy, it's a good idea to make sure that you've really solidified the foundations of your health and optimized your eating, moving, sleeping, and stress management before even considering initiating testosterone replacement therapy. So different modalities for treating testosterone with testosterone replacement therapy. after you've optimized the foundations of your health, we typically like to do injections. Some people like to do injections every 2 weeks. I tend to favor injections once a week or twice a week, because I think you experience less ups and downs with that, and you're getting more of a steady state testosterone. So we do lower doses more frequently instead of higher doses every 2 weeks. There's also gels that are available, but I think most men typically prefer injection. So anyone that's going to go on testosterone replacement therapy, you need to make sure that you are monitoring your labs, especially when you're initiating testosterone replacement therapy. Typical things that we want to look at when monitoring testosterone replacement therapy response is a complete blood count, and really what we're looking at there is your hemoglobin level and your hematocrit level. We want to make sure that those aren't getting too elevated, because that makes your blood thicker and can make you more susceptible to clotting. And so we want to make sure that we're not driving those levels up too high. That's going to put you more at risk for having a blood clot. We also want to look at your complete metabolic panel, comprehensive metabolic panel, and things we're looking at there include your fasting glucose level. We also want to look at your liver enzymes to make sure that those aren't getting elevated with the testosterone replacement therapy. And then we also want to obviously monitor your hormone levels, including free and total testosterone, your FSH and LH, which should be going low when you're on testosterone replacement therapy, your sex hormone binding globulin, your estradiol, because sometimes your testosterone can be converted into estrogen. So we want to make sure that that's not happening with higher levels of estrogen. We also want to monitor just general metabolic markers, including your fasting insulin. I always like to get a fasting insulin level, because testosterone replacement therapy can improve your insulin sensitivity. So I like to look at that. And I also like to look at a lipid profile and your ApoB levels. And those are cardiovascular markers for your cardiovascular health. You know, in the past few years, the TRAVERSE trial has come out and has given evidence that testosterone replacement therapy is a safe treatment as far as it's related to prostate health and the risk for prostate cancer. There is a small increase in risk of having cardiovascular events within the first year of initiating treatment. So we want to make sure that you've optimized your cardiovascular risk profile by not smoking, managing your high blood pressure, and then also looking at your lipid panel before we start initiating testosterone replacement therapy. But I think really just opening up the conversation about talking about some of the symptoms, including low libido or low sex drive, fatigue, and issues recovering from workouts. I think those are the big ones, and then erection quality as well.